Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. On today's episode, we ask the question, does sugar cause diabetes? We are joined by Dr Sandra Isibor, a general practitioner in Nottingham, England. Dr Isibor is a GP with a special interest in obesity and weight management. She graduated from the Leicester Medical School and completed her specialist training with Health Education East Midlands. Dr Isibor is a member of the British Society of Lifestyle Medicine and the Association of the Study of Obesity. She is an advocate for improving the access to healthcare for ethnic minorities, especially those of African and Caribbean descent. She is also known as Dr. Sandy on social media, where she uses her platform to empower people to make realistic lifestyle changes for a better healthcare outcome. Dr. Sandy is a socialite with an infectious energy and a genuine interest in improving partnerships among healthcare professionals in the diaspora. Please join me to welcome Dr. Isibor to the episode. Hello, Dr. Sandra. Welcome to the episode. We finally have you on. I'm so excited to have you on. Finally. How are you?
I'm fine, thank you. I'm really, really grateful to be on this show. Yes.
That's
awesome. As you know. Yeah.
Great. So why don't you tell the people a little bit about yourself, what you do, what you're interested in?
So my name is Sandra Isibor. I'm a GP in the East Midlands of England, and I work at a practice that is quite multicultural as well. My special interest area is obesity and weight management. And I would describe myself as an advocate for improving access to healthcare for the African Caribbean population, both in the UK and globally.
Yeah, awesome. And what made you sort of interested in weight management and, sort of healthy living, weight management, that side of medicine?
I think it's just been a transition period. It's been an ongoing thing for a long time. I've always been interested in health anyway, because I know health should be the core of an individual, because it's as important as anything else. I mean, without health, you can't even make wealth. You need to be healthy to be able to function and to be happy. So, I mean, I guess that's why I also became a doctor.
Yeah.
But in terms of fitness, I noticed this was actually about 2008. Okay. So I've always been a slim fit, and obviously I went abroad, stayed in America for about a month, and I noticed I went from a size 8 to a 12.
No way.
I did actually. And so, but then when you get to that point, you're not even sure how to go back, and to be honest, it never really bothered me that too much, because I had other things. I was busy with medical school, but then over time you realize actually you're not being healthy, and how can you be teaching other people to be healthy when you're not fit yourself? So obviously started reading about nutrition and exercise, and just gradually, but then saying that I've always been an outdoor person. I love exercise, although I loved exercise, but then because of the social factors around me, I wasn't exercising much. It's interesting how you can obviously switch because of the environmental factors.
Definitely.
Until I made an informed decision to actually become a bit more thoughtful with what I ate, and increasing my level of physical activity. And to be honest, I've not looked back since then. It's been like waves, sometimes you do more than other times.
Yeah.
I'm always, trying to make sure I stay fit and healthy.
Yeah. That is fantastic. And oh my goodness, from an 8 to a 12 in such a short span of time. But that America will do that to you, like their portions are so huge. The sizes of the slice of pizza is massive. It's like the size of my face. Like,
it was a culture, to be honest. I think I never expected it.
You never expected it.
Yes, you know that, right?
Yeah, wow. Okay. So today we're going to be talking sort of on that line, basically, which is obviously it fits into your special interest as well in terms of sugar and diabetes. And the main question we're asking is, does sugar cause diabetes? What do you think?
That was actually an interesting question.
Mm.
Okay, I'll say yes, no, because as you know, there are different types of
Yeah.
diabetes. There's type 1 diabetes, which has got nothing to do with the amount of sugar you're taking. It's because there's a small organ just that lies behind your stomach. It's called the pancreas. It's not working as well as it should do. So that's why people become diabetic type 1. So they will need insulin because the pancreas is not producing insulin. So they will need to be given insulin to be able to function normally. So that's definitely nothing to do with sugar. But then you've got type 2 diabetes. Again, type 2 diabetes is obviously quite common. That's one a lot of people refer to.
Yes.
And I wouldn't say sugar causes type 2 diabetes either. There's no direct link. However, if you eat more sugar, you're more likely to put on weight. And as we know, obesity is one of the major risk factors for type 2 diabetes.
And so tell us a bit more about sort of a diagnosis of diabetes. So how do we then get to that point where we're saying to someone, you know, you've got diabetes, and then we then start talking about sugar intake, because that's when it then starts to become an issue, isn't it? When people realize that actually I've got this problem and the doctor is telling me that actually my diet contains way too much sugar, and they've never really thought about it before.
Okay, let's just go back to the basics in terms of diagnosing diabetes. As we know, a lot of patients or people are not symptomatic, so you don't have any symptoms. Most cases of diabetes is actually picked up incidentally.
Yeah.
People might have had screening for the work-related issues, or some people say the men's or well women's check.
Yes, yes.
Good, everyone should have that.
Yeah, definitely.
So that it could have been picked up incidentally. However, for some people, they might have symptoms. So it could be you might notice that you're peeing a lot, or you're becoming quite thirsty.
Yeah.
And for some people, they lose weight.
Yeah.
Although we know that obesity can be linked to type 2 diabetes, for some
Yeah.
people, because of obviously the amount of sugar in the blood, they lose some weight. And also, it could be even subtle things like recurrent water infections or recurrent thrush infections. And for some people, there's something I need to mention, which I don't think we talk about much because, you don't really think about it. But for some people, they might have what we call acanthosis nigricans.
Yes.
So
Yes.
they're like a dark velvety patch, tends to be around the neck. It can be on the armpit. Yeah, exactly.
That's actually really important, because there are a lot of people that go around, especially darker skinned people, who go around with those patches and have always sort of felt that they've had it for a long time, but it might actually be an indication of diabetes and other medical problems.
So, obviously, if you have any of those symptoms, you need to go to your doctor, and it depends on what part of the world you are.
Yes.
So the first thing that's done is either a urine test or a blood sugar test, so with the pinprick test. And obviously that's not enough to diagnose diabetes. So you would need to have more definitive testing, which could be in a form of fasting blood sugar. So that's where you're asked to fast overnight and then you have your blood taken the next morning. Or it could be in form of blood test called HbA1c, which it tends to be used predominantly in England right now. If you haven't got any symptoms with diabetes, it's recommended that the test is repeated to just confirm the diagnosis. If you've got symptoms, to start treatment anyway. Yeah. Although we can't do the test just to be prudent.
Yeah. Okay. So when people then have had this test, and the HbA1c is quite a good test as well, because it shows the coating of what we call your hemoglobin, which is part of your red cells, over a prolonged period of time. So it's not just a snapshot, it's actually a snapshot over about 90 to 120 days, and it's a lot more accurate in a lot of people. But then when they come in and you finally tell them, okay, yeah, you do have diabetes, either because both of your HbA1cs at separate occasions are high, or you have symptoms and your fasting sugars or your HbA1c is also within the diabetic range, and then they say, oh, is it because I eat too much sugar? What should the right answer be?
Not entirely,
Okay.
but absolutely sugar. It's not good when you're definitely diabetic. And even I mean, too much. I mean, sugar is not necessarily the bad thing. Actually, before we go on, let's break it down. So when we talk about sugars, we've got natural sugars. Okay, so natural sugars you will find in foods. You will find in like fruits, dairy products, and then you've got added sugars. So in processed foods, so you can have added sugars in like cakes, pies, pastries, sauces, those sort of things. So when we say natural sugar, obviously natural sugars are healthy to an extent, as long as you're not consuming too much. Added sugars, you don't necessarily need added sugars. But again, I wouldn't say it's about obviously taking things in moderation. I wouldn't say it is the main cause, because yes, I mean, trying to address the African population, when we talk about sugars, and people think more about they think about added sugars only, which is fair enough. But then also there are natural sugars. So if you have very sweet fruits, okay, that can also affect your sugar level, the control of your sugar in the blood. But on the whole, I would say definitely moderation, yes. But that's not all. When we talk about type 2 diabetes, there are other risk factors. Okay. So diet and lifestyle is definitely one of it. Sugar is one part of it, because that, as you know, diabetes having excessive amount of sugar in the blood. Okay. So raw sugars, added sugars is one aspect of it. But then we've got things like saturated fat. So that's fat you get from like cooking oils, mainly the like, you know, things that like coconut oil, palm oil, those sort of things. Palm oil is actually more trans fat, which, as you know, saturated fat can become converted to sugar in the blood. So I know people know it as sugar, but we refer to sugars as glucose. So it can become converted. So that can obviously affect your sugar control in the blood. So that's one aspect of it. So diet, definitely. And then lifestyle, obviously, if you're quite sedentary, not doing much physical activities, the risk of type 2 diabetes is also high. And we've got obesity. So I mentioned obesity earlier on. I mean, from the studies that have been done, actually, 80% of type 2 diabetics in England, this is based on England's statistics. So 80% of people, diabetes is actually linked to being obese. So you're 80 times more likely to develop type 2 diabetes if you're obese.
That is a very shocking. Well, I mean, I say it's a shocking statistic, but it's not really, if you think about it in terms of the facts and the understanding that we have of the illness, the nature of the illness, and also the kind of lifestyles that we currently engage in as well, and the way we eat. I was on a talk show recently, and I talked about how a lot of us graze throughout the day, and people didn't like that term. They said, "Oh no, grazing is for animals, and it's cows and goats that graze." And I was saying, yeah, but we humans, we started doing that now in our lifestyles. We don't actually have set times where we eat. We sort of eat at work and have a biscuit here, a cake there. Someone puts something in the coffee room, and we go to quick things that give us a quick boost of energy.
Absolutely.
And then we don't then have active lifestyles. So we take the train to work, or the bus to work, or we drive to work. And all things then eventually build up. But then how do we then still staying on sort of the sugar side of things? So, in surgery, sometimes I'd have patients say to me, "Oh yeah, well, you've said I have diabetes, and now you want to take away all the pleasure in life." And the message I'm trying to bring across is, I'm not trying to, extinguish or excommunicate sugar from your life. No, but it's about trying to have a balance. So as opposed to saying you're never going to touch refined sugar again, how do we then get you into actually saying you might touch it, but you'll touch it in a moderate way, in a balanced way, so that you're doing something beneficial for your long-term health? Does that make sense?
Yeah, that makes sense. I mean, we need to make it clear. Sugar itself, it's not a bad thing.
Yes, exactly.
Having excess of sugar, that's bad. With type 2 diabetes, as we know, the main problem is the fact that you're either producing less insulin, okay, or your body is actually producing insulin, but your muscles, your liver cells, your cells in your body are not responding to the insulin that's produced. So what we call insulin resistance.
Yeah.
Okay. So imagine if you, I mean, like if you consumed, you know, you were saying something about having quick burst of sugar, so things with high what we call glycemic index. Because what the high glycemic index, it means once you consume it, obviously it goes straight into your bloodstream. It can send your sugar levels up pretty much straight away, but then it's obviously gone
and then
in like a
really quickly,
time.
well, doesn't it? Yeah.
Hungry again, you're back to square one, and you stop eating more. But during those times, your sugar levels are obviously high, because especially like you said, if you're sedentary and you've not used it up, it will be in your blood. Okay. So in terms of, definitely, I mean, with diabetes, so I would never say to a patient you would not be able to consume refined sugars ever again. Okay. If you can avoid it, that's great. I mean, normally why I advocate is for alternatives. Okay, so let's say, I mean, in terms of like cup of tea, you know, instead of using refined sugar, you could maybe try some honey, which has got sugar. So it has to be like maybe half a tablespoon or a teaspoon rather of honey. But myself, I use I'm not diabetic, but I use stevia because it's got 0 calories.
You know, it's amazing that you talk about that, actually, because there's been a lot coming out now about sweeteners and should we actually use sweeteners or not. And it was when I was in medical school that I actually stopped adding sugar to my coffee, just because I just thought, well, you know, I have so many cups of coffee every day already, which is a problem in itself. But if I'm adding a teaspoon of sugar to it every single time, then that is probably not, you know, that is not going to help me long term. And I think making kind of simple switches are not seem big, but long term they're actually really important. And I think sending these messages across to patients, that is really, really important as well. What other kind of things are simple but practical and can be maintained long term?
Okay, so just sticking to diets at the moment. So I mean, there's no specific diets for diabetes, but what would recommend is fiber-rich carbohydrates. So instead of your white rice, which has got a lot of starch, you can have brown rice, which has got fiber. But as you know, obviously, it still contains calories, so you still have amount and proportion. Okay. But the important thing is that you're getting more fiber, which obviously, and the thing about fiber-rich carbohydrates is that it's got so it stays longer in the blood. Okay. So obviously your body breaks it down slowly. So it would stay for a long time. So we're talking about GI indexes, so this is a good one to have. Which
and fiber-rich foods as well also suppress, you know, that feeling of hunger as well. So when you eat it, you don't suddenly feel like, oh yeah, I need to go and have something else immediately. But something that I was going to mention as well is, what about sort of in the sort of African Caribbean society environments, or sort of Asian societies as well, eating large amounts of food is normally considered normal, or people say, oh no, people are going to say that I'm not eating enough, or are going to be worried that, oh, my portions I've reduced them way too much. What would you say to people who feel, oh no, you're telling me to eat too little for my natural body size?
Talking about body size, to be honest, it's not just about body size in terms of how, because I mean, to be honest, what you eat should be personalized. So the amount of calories you take in should be personalized. It depends on your goal at that time. Because if you're trying to lose weight, you need to be having very low calories. If you're just trying to be normal, maintain your weight and your blood sugar, then you need to work out what the best calories would be depending on your body size, if you're male or female, or depending on also the level of physical activity you do. Okay, there's no one fixed rule. I mean, on average for a woman, you're looking about 2,000 calories just for maintenance. Okay. So in terms of course, you need to think about how much you're eating. As we know, in African population, I had to also change my eating habits, because you're used to being given large portions of carbohydrates, especially.
Portions of too much jollof rice, people, like too much
jollof rice, too much white rice, too much eba, pounded jam.
Exactly.
You know, I remember, you know, as a child, actually, I'll be like, oh no, I don't really want to eat eba, and they'll be like, no, you have to eat your eba to eat your soup and your meat. I'm like, no, but I'm okay now. If all I had my soup with all the vegetables and meat in it, I would be, having very highly nutritious food. I don't need to eat that. But we're like, you must finish your food. I'm sure everyone can relate to that.
Yeah, definitely.
That did not help my life, but now I'm in control, so I can definitely cut down on my portion size. We're talking about switching. Instead of having a bar pounded jam, especially if you're already diagnosed with diabetes, some people have oats.
Yes.
So you can have oats as your swallow because it's got fiber-rich carbohydrates. So that's something else you can switch with as well.
Yeah. Or you can switch your jollof rice to bulgur, lentils. Yeah. So you can, you can make jollof lentils as well. So there's a lot of things that you can switch in terms of your diet and what you're eating. You can have quinoa with your vegetable soup as well on the side. There's a lot of things that you're able to do in terms of making those changes on a daily basis. And a lot of people have been referred to the Desmond courses. Have you found that has been beneficial for sort of Afro-Caribbean patients, or do you think that it's more geared towards sort of a standard British diet?
Okay, so I think the part of the issues is also access. Okay, I've had the privilege of observing the course, not the Desmond course, but this was the diabetes prevention course, which I mean it's quite similar. But to be honest, the amount, considering that diabetes is more predominant in the African and Caribbean population and the Asian population, the actual participants, I would say they were more Caucasians. So I mean, you could say, the general feeling is that the Afro-Caribbean population, or the most at-risk population, they're not actually accessing the services. And if they're not accessing the service, I don't think it'll be fair to start talking about chapatis and jollof rice when there are hardly any Africans on the course.
Fair enough. Okay. Yeah, fair enough.
So I think the courses are quite good.
Yeah.
But obviously, to help with planning, we need to be able to encourage, like the Black population to attend this course because we need it more. We didn't even talk about the statistics. Like if you're Black, you're about 2 to 4 times more likely to get diabetes compared to someone from the white background or like Caucasian.
Yeah.
Still, our risk is actually high.
Yeah.
So but that's the thing. I think probably we need to have further talks on what's actually affecting, why are people not accessing the services, because they could access it from their GP. Why are Black people not accessing this? I don't know if you've got an answer for that.
Well, to be fair, so I've recently, over the past sort of, I think mainly in December, I did refer to I think maybe about 2 to 3 African patients to the Desmond course. And these were patients who had already been diagnosed with diabetes for a while and they just never heard of it. So they were either already on metformin or glycoside, or on some sort of medication for management of diabetes. But just before we go ahead, I'm just going to let the people know what the Desmond course is. So it stands for Diabetes Education and Self-Management for Ongoing and Newly Diagnosed. And that is for two diabetics. And basically it's an education course often run by nurses and dietitians to be able to give people better understanding of how your body processes sugar and carbohydrates so that you're able to make long-lasting changes. And when I mentioned it to them, they were actually quite interested in it. So I think maybe also there might also just be a better need for awareness right across the board in terms of patients knowing that actually there's something that they can access. And also healthcare professionals also just remembering that at any point, when you see someone who is struggling with their sugars, or someone who's newly diagnosed, just mention it to them. Or if they have been diagnosed before and you're assuming that someone has mentioned it to them before, there's no harm in just saying, have you ever been to the Desmond course? Did you find it useful? Do you want to go again, for it to sort of jog your memory? And I think that might be something that might help. And maybe with time, the course itself might then start to change. And then we start talking about chapati, ugali, rice, those kind of things, so that we can make some differences as well in it. But what about portion control? What would you say? Because I think that is also something that is an issue What tips would you give people in terms of controlling their portions?
Okay. What I'd say is make changes that are realistic.
Yeah.
Okay.
Realistic is the word, guys.
Because I've had patients I've seen on the first day, they're like, oh, I heard you can reverse. They've just been diagnosed with diabetes. Oh, doctor, I heard you can reverse diabetes. How do I reverse my diabetes? I'm like, no, let's just start from the, let's do baby steps. Let's walk first before we're running.
Yeah.
Okay. So if you were eating a large, I wish I had a plate here. If you were eating a very large bowl of rice before, you can't just go straight to not having rice at all.
Mm-hmm.
Okay. So it's about gradual progressive changes.
Yeah.
Okay. But if you were to ask what the recommended, okay, normally what I'd say, some people count calories, and like I said, you can work out what your daily requirements are. On average tends to be about 2,000 calories. Or if you had a plate, what works for me. Okay. It's best to put your vegetables first. I see the vegetables as the main thing on the plate. So half of my plate should be vegetables.
Yeah.
And then the other quarter should be carbs. So, but like I said, fiber-rich carbohydrates.
Yeah.
Okay.
Yeah.
And then the other quarter of the plate should be your protein.
Yeah.
So again, protein, healthy protein. So like legumes, you could have some meat or fish, but having lean meat instead of meat with a lot of, because Africans, we like the broccotos and those with all the fatty stuff. It tastes nice, like you can't deny that. But I didn't
it makes soups, the sauces taste so rich, and like as you're eating it, you can but it's not.
Yeah. So it's about looking at having a healthy plate. Just aiming to have a healthy plate. The other thing I would say, actually, a lot of times we focus on, what do I need to, what should I not do to lose weight, to get my sugar control. But how about what you can do? What might be a good thing to focus on is, how can I have nutritious food?
Yeah.
How can I eat more nutritious? How can I make sure I'm getting like my minerals, my vitamins, getting folic acid, iron from my food. So eating more greeny vegetables, rather than just having a plate and like, I'm just going to eat because I'm hungry. It's just rice stew, and meat. I'm like, how can I have, salad on this, salad, and then have just a little bit of rice and sauce. But just, being aware. I think the first thing is, first of all, being knowledgeable, because there's not a lot out there on nutrition unless you go out to find out yourself. But maybe the first thing will be able to educate yourself. There's a good website, so diabetes.co.uk talks a lot about nutrition, talks about diabetes control. So there's a lot of places where NHS Choices is another one. So you can get more information, and hopefully with knowledge, then you can apply the knowledge and to see some progress
and make the right changes. And what about people who feel that they're bound to get diabetes because they've seen their grandfather have it, their grandma, their mom, their dad, their siblings, and they feel, okay, you know what, this is a genetic thing. So this type 2 diabetes is a genetic thing. I'm going to get it anyway. So I might as well just live my life while I can. And when I get it, I get it. What would you say to that group?
Yes, you're not bound to get it, but your risk of getting it is higher. So if your first degree relative, if your mom, your parents, or your siblings, if they've got diabetes, you're 2 to 6 times more likely to get type 2 diabetes. So your risk is going to be higher than the general population.
Yeah.
But again, we think, if you are aware of that risk, then you can try and do something about it.
Yeah. And so once you know where you stand, then you can then make the changes that are going to last to be able to help you as well. What about so you mentioned something that was really important. You said there's no one specific diet for diabetes, and I'm gonna touch on a bit of a minefield area. We probably wouldn't have time to address it today, so we'll probably have to bring you back in to discuss it. But what about the group of people who say going keto is going to cure their diabetes? There's been a lot talking about that recently. I think I saw that on the news the other day. A chap who'd done really well for himself and going from being morbidly obese to being within a normal BMI, and he was a champion for going keto. What would you say about that that cohort and that belief?
Well, I would say that's true. Keto diet can actually you can actually reverse diabetes on a keto diet.
Yeah.
Okay. However, I just need to make it clear that keto diet is not for everyone. Okay. When we talk about keto diet, it means you're going to be consuming less than 50 grams of carbohydrates, so very, very little carbohydrates, and a high amount of good fats in the diet. Okay. I mean, for some people, it's not sustainable. Okay. So that's one thing. And then we don't actually have a long-term safety data. Obviously, there are people that are doing well, improving their diabetes, but there's no long-term safety data on the keto diet. And you can't, I mean, I wouldn't recommend the keto diet definitely if you're pregnant or if you're lactating or if you've got kidney disease. So it's not advisable. And saying that, keto diet is just one aspect of, eating. Again, like what I would say is work your way. I mean, what's the difficulties you're having? If you feel you're fine having less carbohydrate, that amount of carbohydrates, and having a good amount of fat, that's fine. But for some people, for someone like me, I love a bit of everything.
Yeah.
So I just want to be able to eat what I like, but then have less of the things that I shouldn't.
Yeah.
Or try to more or less. I won't say I don't strictly calorie count, but just roughly get an idea of how much calories I'm consuming. So it depends on what I wouldn't do the keto diet, but again, some people can do it successfully, and that's fine. Okay, but I just want to highlight there's so many other diets out there. There's a DASH diet, there's Zone diet, there's Orange diet, there's Mediterranean diet.
Oh my
there's so
goodness, it's so overwhelming. Honestly, every single time someone comes in and says, "Doctor, I'm on the so and so diet," I have to actually pause to clarify, like, okay, what exactly is this diet? What are the contents? What is the main belief? Because every new day there's a brand new one. Dr. Oz in the US just came out with another one, and the whole medical community in America is going crazy. A lot of them don't like it, and questioning him.
We could also come up with our own. We could also come up with
so
the African population.
There's just so many diets out there, and I think that the critical thing is actually understanding your own body and making sure that you're getting advice that is tailored to you.
Absolutely.
To you and your lifestyle, the kind of life you're living as well. And what about this? Because I think because obviously we're busting myths and debunking myths via this podcast. Eating 3 times a day is that what is that? Where did that come from, and why do we do it?
That's a good question. I mean, if I was to answer the question for myself, that's just how I was brought up. Have breakfast before school, have lunch when you get home, and have dinner before you go to bed. Okay. But again, everyone is different. Cultures are different. Like if you go like to Spain and they have their dinners at like 12 or 1 I don't even know if that's dinner or if it's breakfast because like 1 a.m. or something. So I don't think it depends on your level of physical activity, what you're doing throughout the day. I mean, shift workers, it might not be the same thing for them. Okay, but what I would say is actually good to eat small meals regularly.
Exactly. Yeah.
Okay, but again, if you can only manage 3, that's fine. But I mean, most people recommend having five meals or having 3 meals with bits of healthy snacks in between. But there's no right or wrong, to be honest. It depends on. I think the important thing to make sure is that you're actually having nutritious based foods when you do eat. Okay, and you're not like eating junks in between. If you know you're gonna be hungry quite soon, there's no point just eating twice a day and then eating a lot of junks in between.
I think that's the issue, isn't it? It's that people leave their meals so far apart.
Yes.
And you either then end up maybe not binge, but having a really heavy meal, either in the evening or maybe when you get back home and that's the first time you're eating, and then you sort of take in a lot of processed sugar and then have a really large meal as well that might not be very nutritious, as opposed to planning your whole day with small amounts of nutritious, well thought out meals. Is that something that you practice in terms of 5 regular small meals?
I wouldn't say all the time.
Mm-hmm.
It depends on how busy I am.
Yeah.
Well, probably on average, I would say probably yes.
Wow, that's impressive.
Because I wouldn't say meals. I think probably more mid morning snacks and like evening snacks. But you will probably be like, let's say, like hummus and some peppers, in between, or maybe a shake, like vegetable shakes, or like sometimes I can't be bothered to eat my salad, so I just blend everything with like some blueberries and pineapple. But
Yeah.
I try to eat. Basically, I'm not the one. I mean, if you follow my Instagram page,
Yeah,
you would
make
see
sure
that
you
I'm
follow
always
Dr.
cooking.
Sandy and like follow her stories, her food, grilled fish, like vegetables, all the amazing things she's cooking. It's fantastic. It's
Yeah,
so
so
fun.
I'm always cooking.
You might
So
see her husband giving her a thumbs up sometimes in her Insta stories as well.
I mean, saying that, I did try. I wouldn't say obviously. I've had my own share of trying different things and making mistakes. But now I know what works for me. I know I love food, so I need to accept the fact that I love food. But it's making sure that the food works for me.
Yeah.
Because what happens is when you have excess than what your body actually needs.
Yeah.
So I make sure I'm obviously eating properly, but also exercising regularly. Try and be active to make sure I'm burning some of the calories off.
Yeah.
But again, I try not to overeat.
Yeah.
So yes.
That is really important. And just one thing before we go towards the end of the episode, you mentioned just exercising now, and obviously we know that you're a bit of a fitness buff.
That's important for everyone. I think the problem now is that we're getting into the category where people think, oh, I'm fit and healthy. But are you really fit and healthy? You might be fit and healthy now, but if you're not doing the right things, in the next 5 to 10 years, who knows? You might switch to the next category of being, what you might consider, having some chronic disease. So it's doing what you can now to not just only treat the condition you've got, but also to prevent you from developing, things like obesity or diabetes.
Mm-hmm.
So in terms of exercise, definitely, I would say start small.
Mm-hmm.
Again, it's about, I remember when I started exercising like properly, I couldn't even, like, I would run and I'll be panting. I would say definitely try, give it a go. Your body's designed for it. If you keep feeding your muscles with the right stuff, obviously it's going to get stronger, and then that would help you to be able to work better even.
Yeah, definitely. And I often say to people, we always recommend that 30 minutes a day, medium intensity, raising your heart rate. But I'd say go out for a walk for 5 to 10 minutes initially, and do that consistently for a month, and just 5 to 10 minutes is actually not that much. By the time you come back home, if you've got a long day at work, whatever it is, just 5 to 10 minutes initially. And once your body's used to doing that, then you can then start to build it up a little bit. And exercise does not have to be an hour in the gym every single day. It could be with a YouTube video at home, and there's things you can do to make it fun. You can join a park run, locally. Little things like that can make a
dancing. I enjoy dancing, so dancing for me,
dancing
the word
fantastic. Yeah, there's Zumba videos online that you can do. So there's lots of things that you can definitely do. Just listening to Afrobeats at home and just dancing to it while you're going.
Some Burna Boy.
It's definitely something that is effective.
I know we talked about aerobic. I was just going to say resistance training as well.
Mm-hmm.
So even if you can't go for a run, you can just start with some little weights.
Mm-hmm.
So like the dumbbells. Everyone should do resistance training, because even if you don't feel like it's beneficial for you now, that would help you for when you become older. So you strengthen your muscles and your bones, but then it reduces the amount of what we call visceral fat. So that's the bad fat that you don't want.
Yeah.
Resistance training is actually important. So not just aerobic exercise is good, running and the rest is good, but just strength training, working out those core, just simple weight training, even if it's, like doing dumbbells, just even 10 a day is better than nothing. So every little helps. That's what I really want to say. Okay. And just, can we end on a positive note? For obviously, this talk has been about diabetes. So I just want to quickly touch on what we call the direct trial. So this was actually done in the UK. So they recruited about 5,000 patients, just over 5,000 patients with diabetes. And then they were exposed to intensive lifestyle, so low calorie diet. So they started with calories about 800, and then it was increased gradually over a few weeks.
Yes.
Then also they were given structured exercise programs. Okay. So what they actually found that about, even because the patients were studied over a long number of time, but after 2 years, about 36%, so that's over a third of, the participants, they were actually able to reverse their diabetes just with, intensive diet and lifestyle. So it is possible. We're not just saying all this just because, just to mention, but it's really, they are real life patients that have actually reversed their diabetes, and they're obviously a lot healthier. And it's not just diabetes, because when you're healthier, obviously that improves your cardiovascular fitness, so reduces your risk of also having a heart attack or stroke. So hopefully we'll get to talk about this in more detail, but so glad to be here.
Definitely, and that is such a positive note as well, that diabetes can be reversed, it can go into remission, and the main thing with moving it backwards is actually intense lifestyle changes as well. So because we're trying to make everybody a health champion, what would you say today as a takeaway for people who want to become a health champion wherever they go?
Be yourself. I know it sounds very silly, but be yourself and be a better version of you. Okay, and then also you'll be able to help other people in that way. But obviously, just being self-aware. The first thing is treating your body with respect. Okay. So with TLC, you won't be eating junks. You won't be putting junks in your house. So why would you put junks in your body?
Say that again. Say that again for the people back.
So I don't know about, maybe some people would, but I personally wouldn't want anyone coming to throw garbage in my house. So I would obviously definitely not throw garbage in my house. So if you think of your body like a temple, do not throw garbage in there, and try and get out what you can get out that is rubbish. So that might be through exercising to help burn off the excess that is not meant to be there. So think of it that way, and I think that will help you.
Fantastic. Treat your body with respect, and since you don't keep junk in your house, don't put any garbage in your body. Thank you so much, Dr. Sandra. It's been absolutely a pleasure having you on today, and hopefully we'll have you on again sometime soon. Make sure you guys follow her on Instagram, Dr. Sandy, and I will link her Instagram page beneath in the notes on iTunes. Thank you.
Thank you.
Thank you for joining us on today's episode. Remember that this podcast in no way replaces the advice you receive from your own doctor or physician. Don't forget to subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And do join the club at asliceofhealth.club, where you will also be able to access the profiles of the guests we've had on today. And don't forget to be a health champion wherever you are by separating health fact from health fiction.